So I'm Jamie Farage-Holy, project coordinator for the IEHIO, and I'm also the project lead for the Connect IE program, partnership between IEHP, 211 San Bernardino, 211 Riverside, as well as Desert Healthcare District and the IEHIO. And basically what Connect IE is we are a community resource platform, and we offer care providers and the public in the Inland Empire community resources that are free and reduced cost. Some of the critical resources that we offer on the platform include food banks. We have food drives right now by IEHP, so one-day food events that have been added specifically for COVID relief. We also have healthcare, mental, behavioral, physical health. Housing and rental assistance is a big one right now as well. Transportation, so that includes bus passes. We have COVID-19 testing sites on the platform, as well as we are adding vaccine clinics. And I'll show you that on the landing page in just a moment. Some additional resources include employment assistance, job training, special skills training, and just many, many more categories and subcategories that we'll get into in the live demo in just a moment. So I feel the best way to learn how to use Connect IE is by showing you rather than explaining it. So these are the 10 main points I'm going to highlight as I take you through our demo. I'm going to show you how to navigate the homepage, filter search results, take next steps on a program, share programs with your patients, take the personal needs assessment, as well as create an account, save programs, refer your patients to programs, create teams within your department. And if you do happen to have any programs on Connect IE, I'll briefly show you how to manage those programs and change any information that you need to change on there. So I'm going to switch over to the website real quick. Okay, so this is the Connect IE landing page, and basically you're going to see everything that you need to right here. So our simple search engine is right here. All you need to do would be to enter a zip code. You don't have to put a category into the find bar, but we recommend this just because if the patient you're searching for knows the kind of resource that they need, then this would limit this would narrow down the results and make them a lot more personable to that patient. But you can definitely just type in a zip code and it would show you all the resources available within that zip code. And there are thousands and thousands of resources available. So we'll get to that in just a moment as well. We have this great little drop-down menu right here, and it can translate instantly into the entire site into any of these 70+ languages. And because Spanish is definitely our most commonly translated language, we have this nice little button right here that'll instantly translate the site. And that way people don't have to go scroll all the way down here. It just makes it a little bit easier. And then those vaccine links that I told you about are going to be right here for both counties. We have the information about who's currently eligible right here in red. And these are going to be great resources for your medical staff and your providers, because patients likely have already been coming to you asking about when they can get vaccinated, when they'll be eligible, where they can go. And these are going to really be helpful for you in sharing that information with your patients, because then they can just bookmark, whichever county they belong to, and they can just view the updates as they come in. Lastly, like I said, the personal needs assessment is at the top here, and we'll go over that in a little bit. I want to show you kind of how the search results look before we get into that. So I'll go ahead and put in just a generic Riverside zip code here. We'll search for food. And if just as we go along, if you have any questions, feel free to put them in the chat, and we'll get to them in just a little bit. So these are the search results here. The first thing that you're going to want to do is sort by closest. If you're searching on behalf of a patient and they give you your zip code, then you definitely want to make sure that the programs that you are referring them to are going to be the closest to them, just because many individuals have difficulty accessing transportation. So that's just one little tip there. There's 3 categories of filters for your search results that you want to look at as well. So personal filters, These would involve, you know, homeowners, or if the person you're searching on behalf of is a mother or a caregiver, and as well as health issues, disabilities. And if you pick any of these personal filters, and that would really narrow down the search results as well and make them more personable to the individual you're searching on behalf of. There's also program filters. So if you would prefer to email or call or visit in person, then that would filter out those, the hours that they're open. And of course, if your patients are only looking for free programs and not reduced cost programs, then you would definitely want to check this box here. Another one is language. So if you have a Chinese speaking patient, then you would want to click that one. So you can just see here all the languages that are served within this zip code for the search we did, which is food. The last filter would be income eligibility. So many of these programs do have kind of an income cap for reduced cost services, as well as, well, the free resources as well. So if a patient makes, you know, too much per household, then they might not be eligible for certain programs. And of course, you would want to be able to filter those out so that those aren't shown to them in their search results page, sorry. So I'll go ahead and show you this program here, just as an example, More Than a Meal by Family Service Association. This blue check mark here means that the program has been claimed by the provider. And basically what that means is that they are frequently managing their program on Connect.ie, making sure that the information they have is up to date, accurate, and there are no issues there. So this would be the program card, and if you just click more info here, it'll give you all the details about this program. So the individuals it serves, seniors 60 plus or disabled, the availability. So if it's available now, some programs are not going to be available because of COVID. The description, languages served, the cost if it's free or reduced cost, as well as this nice little Google map here where it'll show the patient exactly where the program is located. Oh yeah, and then there's this nice little print view. So if you were, you know, if you're a medical staff and your patient comes in and you want to hand it physically to them, you could also do that by just printing it out and handing them the program description. So I will show you quickly the See Next Steps area. This is just going to give you the best way to connect with this particular resource. And if you're helping someone else, you can log a referral, which I'll show you in a little bit as well. You can share programs without having to create an account. We do know that some patients and community members just don't really want to give out their personal information, and that's perfectly fine if they don't want to create an account. So you can just send them a personal email with the link to the resource, or you can send them a text, or if you don't have their text or email, or you don't want to communicate that way, you can just share it on Facebook, and it'll show, I don't know if you can see my screen here, but it'll give you the option to just share with all of your followers there. Okay, and so it's important to note here that all these 5 steps I just walked you through, you can achieve without creating an account. So for those individuals who don't want to create an account, you can certainly do that. And that would provide that full loop of care, that closed loop of care, which means that you were able to get the resources into the patient's hands. They were able to get contact with the program or the provider, and then they were able to receive the resource offered. And that is our main goal at Connect.ie. That's something that we've been working on a lot lately, is increasing our closed loop of care rate. So last year, it was in the 70% area, and now we are up to 85%. And that's because our outreach team at 211, as well as us at IEHIO, have been working very, very hard to make sure that everyone who is referred is being followed up with by these programs. And so real quick, I'll show you how to do the personal needs assessment now. And this is going to be very helpful for your patients who aren't really sure where to start. So if you have someone come to you and say, I need help, but I don't really know what to do or where to start, then you could always refer them to take this assessment here, which is the protocol for responding to and assessing patient assets, risks, and experiences. Again, you can select your language here, translate it into any of the languages offered. And then they would just have to fill out these personal questions. So these are probably going to be an issue for those individuals who are a little bit more reserved, but you can assure them that all this information is entirely confidential. And the only reason it's collected is so that the results that are given to them on the next page are very relevant to what they need based on the responses that they give. Okay, so with that, I will go ahead and show you how to sign up and go over just the benefits of signing up real quick. It's definitely beneficial for you as, you know, a person working in a medical business or a provider, or even someone who works for a CBO, just because you can save and share lists of programs directly with your patients. So if you, let's say you have 3 food resources that you want to share with patients, you can save all 3 to one folder and then share all of them at once. You can also contact and refer directly to the programs on Connect.ie. So the referral feature that we talked about earlier, you can do that with an account as well. And that way you can track all the people you're helping in a very organized dashboard. You can also make notes about programs, rate them, just so that you can go back and look at them later and use those as a quick reference, especially if you're helping, you know, a lot of different patients. So all you would have to do to sign up is enter your information here. And then if you wanted to sign up by phone, you could also do that instead. So because I have an account, I will go ahead and sign in. Okay, and then it'll just take us back to the last page we were on. So I'll go ahead and look for food one more time. And this is the one that we were looking at earlier. So to save a program, you're just going to click this button here. I have one folder called food. I actually already have this program saved there. So let's go to this one. So we'll save it to food. And then once I'm done doing that, it'll have a quick link that'll take you straight there. And then if you open your folders, it'll show you all your folders here. You can open it up and then it'll have all the program cards right here. You can, like I said, you can share full folders. You can share them as a link or as an email, or you can print it out. And if you do that, it'll have all that program information right there on the printable page as well. So again, that's very helpful for individuals who, or for patients who are coming into the office, maybe at their next appointment, you want to hand them just a list of resources that you believe might help them. That would be, you know, a great option. So let's go back here. Okay, so logging a referral, we'll talk about that real quick. Referrals are basically so that the goal with referrals is for the providers who are providing the resources so that they reach out and get connected with the individuals being referred. And the way that happens is the referral will be sent to the program. So this little disclaimer right here says the referral will not be sent to the program. That is the case with some of these resources, but most of them do accept referrals. If they don't accept referrals, then you can still log a referral and it'll still show up in your own dashboard. And that way you can still track the patient's care and you can still follow up with them and help them get connected to the provider. So that's an option as well. But that's what I was talking about when I was talking about that closed loop of care. That's the referral system that we use here. And all you would have to do is just put your own name. Sorry, this is referring for someone else. You would put your own name here. And then if you already have their contact info on file, so if you've already referred them to a program before, you just start typing in their name and it would pop up. Or if it's a new contact, then you would just enter it here. Best way to reach them, and then put their email or phone or both if they wish. And we just do ask that you get a verbal consent from them before logging a referral or sending a referral out, just so that they know that this program will be, or this provider will be getting in contact with them for the resource that they were referred to. And then once you make referrals, you're going to go into here, your people I'm helping dashboard. I don't really have a lot going on here just because all my Connect IE stuff is for demos only, but I will show you quickly here. So this is someone who is on my team, and I'll talk about that too. And I referred her to this program here, Community Partner Food Distribution. And you can put the status here. You can update it, needs action, pending, eligible, couldn't get help. And this helps you, keep track of the people you're referring and the care that they're receiving or not able to receive for whatever reason. You can add notes, and you can also add forms or documents. So like I said before, a lot of these programs do have eligibility requirements. So if they needed to prove their eligibility, in document form, then you could upload that here and then send all that with the referral that you send out to the program. And that way it's all together, and then there's no extra steps needed there. Okay, so I'll also talk to you quickly about how to create teams. That would be under program tools right here, my team. And basically what that would do is, or what you would do there is you would enter information for all of your department members who you want to work with on Connect IE. So for example, if you and your staff want to kind of tag all your patients in one population, then you could create Connect IE accounts for all those team members, and then start making referrals and helping all the patients that you're targeting. And then everyone who's on your team on Connect IE can also view the activity for all those people that you're helping. So for example, if Jana and I were on a team, then I would be able to see, or she would also be able to see this person's referral history. So that way, if I'm gone one day, then she can just jump right into Connect IE on her own account and see all this information and be able to continuing following up care for this person. And that way, no step is missed in that individual's care. The last thing I'll show you how to do is if you do have, one second. Users and groups. I'm going to show you how to manage your listings. Actually, there it is. I'm sorry. I have this Zoom bar kind of in my way here. Okay, so if you have any programs, and this is where you'll see them here, you can edit contact settings, hours, and locations for your programs freely. If you do have any other changes that need to be made, then you would need to submit a form right here. It's very easy to do, and the vendor of Connect IE, Aunt Bertha, their support team is very active, and they usually get to these requests very quickly. So that's another thing that is good to know about the platform. And that is pretty much the demo. Does anyone have any questions? Okay, while I wait for questions to come into the chat, we do ask that if you have the means to insert the simple search box, so the Connect IE box right here, onto your organization's website. And this way you can direct your patients to your website, and then they can enter a search and go directly to Connect IE.
Okay, Jamie, it looks like we got a couple of questions.
Okay.
So our first question is, can you make this presentation to my office staff? So I'll let you answer that.
Yes, I can. I was going to address that right now. Yeah, so we hold webinars weekly at 11 a.m. Sorry, Wednesdays at 11 a.m., but we can also schedule personal trainings for anyone at any time. And you could just reach out to me or Mitzi if you have her contact information, and we can get that scheduled at any time.
Perfect, thank you. And the other question is, how would this fit into our office workflow?
That is a good question. It really depends on, I guess, the type of work that you do. So if you're, if you're a medical office staff and you wanted to get patients, connected with resources, I guess what you could do is just kind of incorporate that into your follow-up care with them. That is probably a good question for some of the medical staff we have on the call.
Okay.
Or Jana, if you want to jump in and help with that question.
Let me ask the next question. Can you send us any cards we can hand out to patients?
Yes, like you mean like Connect IE promotional materials, that kind of stuff?
I would assume that's what they're looking for.
Yes, we have that.
There we go. Thank you so much. Sorry about that. Thank you for unmuting me. And in regards to the way that we're seeing this used in workflow with some of the healthcare providers, a lot of case managers and office staff. Now we know provider offices may have a smaller staffing and it may not be one-on-one with patients, but you could definitely hand this to the patients and the patients could search themselves for resources. So for example, right now we have one-day events for Connect IE food distribution that are available in Connect IE. So if you have a patient that has a food insecurity, they could go in here and register for a food box through IEHP. They do not need to be an IEHP member, but that's just one example of how we can hand it to the patients and get it to them. In regards to the question, we do have materials for provider offices. Let us know when we could get you the cards. We have display stands, so patients come in, they could definitely take one home and be able to search the site for any needs that they have. And another way we're seeing this for bigger organizations with like case management, they will utilize it as they're reaching out to the patients and addressing other patients' needs. They do ask some social determinants of health questions. And one way to get the resources to those patients is by using the Connect IE platform. So those are two examples of provider, one example of provider's office and one example of how bigger organizations with a little bit more staffing would be able to use the platform.
Great, thank you so much, Jana. And then we've got another question that, does this website also cover housing for the homeless patients?
Yes, we do have many, many housing resources for homeless patients in both counties.
Okay, great. That's all the questions we have so far. Anybody else? Just type them in our chat box. Okay, we got another one. Can you run reports to see how many patients you were able to help?
Yes, you can, is the short answer. There are program and site analytics that you'll have access to, and you can run reports on the activity that goes through your programs, as well as the activity that your patients take on the site.
Yeah, there's a lot of program analytics on the platform. Even when we create the teams that Jamie was speaking about, that those reports are available on the activity of your teams, like how many resources. We even know we have the reports on how many closed loop, meaning how many people that were referred out actually received the resources that they needed. And all of that is through the platform. So there are some that are generically available to all, and then there's customizable reports depending upon the need.
Do you help for patients without insurance?
There's some resources available. Yes, there's some resources available right now for programs that are being offered to patients without insurance on the platform. There's for one zip code, there's 3,400 results for resources. So we don't put anything that would cost on the platform. So if there's a fee, maybe not like a low sliding scale fee, but anything that's like for profit does not get onto the platform. So we're very diligent about checking for that. So I would go through the platform and see what resources are there on there, because there's definitely stuff in there for, lots of categories.
Okay, great. Thanks, Jenna.
Like we may have lost Missy's connection because she's muted. So does anybody else have any questions, they can add them to the chat. If not, we're able to connect you with Jamie or Jana directly for further information. And you guys could, email each other or maybe have a phone call if anybody else has any questions to contact you guys directly.
Yes, yeah, and for those asking about the program cards for patients, just email Jana and I, and we will figure out a way to get them to you.
I do see one more question. Do the programs close the loop, or do the providers have to update that in the system?
That
That's
would
a
be
good
the
question.
programs. No, that's the programs. They close the loop. So when we send a referral out to a program, like say, I send a referral out for Jamie, I send it to a food bank. The food bank receives that referral and then they respond that they were able to get Jamie assistance. So it's on the program level, not necessarily the provider level, that gets updated from. We're working really hard. When Jamie talked about 84% closed the loop, we're working really hard with organizations to make sure that that closed the loop system is set up. So we're the 211 partnerships are working with the community-based organizations to make sure that they're able to receive the referrals and have the workflow to respond to those referrals.
Okay. So it looks like that might be the last one. I'm just going to give it a moment and see if we have any more that pop up. I know it takes some time to type in. This recording will be available. We're going to post it on our YouTube channel. The YouTube name for our company is RCMA Docs, and also it'll be on our website, rcmadocs.org. So I guess that is it. Thank you so much, everybody. Thank you to San Bernardino County Medical Society. Thank you to IEHP for co-hosting this event. Thank you, Jamie and Jana, for kind of stepping in to assist. And we hope you guys attend our future webinars, and please contact us if you have any other questions. Have a good afternoon.
Bye.